Professor Newton, what is a Pathways to Medicine course?
So the Pathways to Medicine course is a route through some of our undergraduate BSc degrees that allows students guaranteed interview and other experiences to help them get into graduate entry medicine in the Swansea University Medical School.
Okay, how's it different to an undergraduate medical degree?
So our medicine degree at Swansea University Medical School is graduate entry only. So it's a 4-year program compared to the 5 or 6 year programs at many other medical schools. But in order to get into that program, you have to have an undergraduate degree. And so the Pathways degrees are regular BSc degrees in things like medical sciences, genetics, biochemistry, that have a route through them that facilitates giving students experiences and insight into what it's like to be a doctor, and then with a guaranteed interview for the medicine degree at the end, provided they meet the relevant academic criteria.
So why does Swansea do pathway degrees?
So there's a number of reasons why we've set up the pathway in the medical school. The first and simplest really is we think our medical students have a good time. We think we graduate great doctors. They all have to have a first degree. We think our undergraduate degrees are great, so why not do your undergraduate study with us as well as your medical study? There's also a really important workforce need why we've set up the pathway. One of the reasons there's a medical school in Swansea, as with many of the newer medical schools, is because it's difficult for the NHS workforce to recruit and retain doctors to this part of the world. And lots of new medical schools have been put in places where it's difficult to recruit and retain doctors. There's a lot of good evidence that shows if people have come and studied medicine in a particular area and had a good time, they're more likely to stay in practice there. And we've just extended that principle by saying, if you've done your undergraduate with us and then your medicine degree as well, you've been with us for 7 years, the evidence says you're more likely to stay in practice here. I think it's important to say that if you come and study on a Pathways degree with us and then a medicine degree, and then you decide you want to go to Australia or Abu Dhabi or London or wherever it is you want to study medicine, that's absolutely fine. There's no requirement to practice in Wales, but the evidence suggests that people are more likely to stay, and we're just going to put our faith in that.
If I applied for undergrad medicine, would this be a good option for a 5th choice?
Yes, perfect for a 5th choice. And lots of students come to us because they've applied to get into undergraduate medicine as an 18-year-old or as a school leaver. They haven't got in, and they're perhaps causes a bit of a rethink. They've put a Pathways degree down as their 5th choice. They come to us, they do their 3-year BSc degree. Medicine is still open for them as a career, but they're also opening up some other opportunities as well.
So I know what is a pathway, but what's in a pathway?
Okay, so the pathway includes a number of things, and probably the key feature is there's a specific module in year 2 of the 3-year BSc degree. It's currently called Doctors, Patients and the Goals of Medicine, and it's really helping potential medical school applicants understand what it's like to be a doctor. So we know that all the applicants who come to us have a good grounding in science. They've demonstrated to us that they can learn science and achieve in science, but there's a lot more that goes into being a doctor than understanding the basic science. And so in that particular module, there's lots of interaction with practicing clinicians talking about their day-to-day activities. There's also some short clinical learning experiences, because getting out there into the clinic and seeing what it's like for yourself is really the best way of understanding what it's like to be a doctor.